The start of a new year means being active for a lot of folks. For some of those people, that can also mean injuries and sports-related issues. So here from Home Rehab Express is Joanne Ellis and also Dr. Krista Howard from the Foot and Ankle Group. Ladies, good morning. So great to have you on the show this morning.
Good morning.
Good morning.
I'd like to start by telling everybody who exactly you guys are at Home Rehab Express. We talk a lot about home recovery is so much better in the home, and it truly is. So explain to everybody what you guys do.
Sure. Home Rehab Express, we are a home health company. And what we do is send a nurse and a therapist to patients' homes that are unable to make it to the doctor's office or need extra physical therapy or nursing at their own home.
And why is it important to kind of keep those patients in their home, in their own home? How does that help with the recovery process?
Well, definitely Dr. Howard could speak more to that. We actually are able to be the bridge between maybe acute care and complete recovery. Mm-hmm. So we serve the interim purpose to help people remain an active lifestyle onto wellness.
And for example, sometimes with our complicated wound care patients, the patients don't really know how to do it themselves, so they have the trained employees that know how to do it correctly.
So who really is susceptible to this then, these injuries?
For the sports-related injuries, you know, as the start of the new year, people kind of get rushed into things sometimes, and anybody's susceptible to it, but more or less people who haven't really been working out that much, haven't been running a lot, you start, you know, trying to do too much too soon, then you get certain injuries.
And how do you typically treat those injuries then?
Most commonly it's just with simple things like rest, ice, compression, elevation. Sometimes you need more, you know, you need more structure, you need more support and immobilization, but a lot of times you can just treat it with conservative modalities.
And you do kind of get into a hurry here, but how do you know, what is the best way to really prevent them? Because I think that's what we want to do in the first place, right, Joanne?
Oh, absolutely.
Making sure you're doing proper stretching, you know, you're not doing the wrong exercises for you. Just know, you know, your type and what you're used to doing. Kind of don't jump into things too fast. Ease into it.
And is there a certain way you diagnose these different injuries and ways to treat them?
Most of the time it's just from a physical exam. We do have x-ray machines in the office that we use a lot. And sometimes if we need more sophisticated modalities, we do sometimes need an MRI and a CT. And we actually have an MRI in our office that's just a lower extremity MRI.
Gonna mention that. Yeah, that's pretty cool.
You don't have to get in the big tube, you just have to stick your leg in and we can do that for
And if you've ever done an MRI before, I was talking to them during the break, that can be kind of scary getting into those tunnels.
It's loud
type things.
and scary. So yeah, this makes it a little bit easier.
And we've got just about 30 seconds left. If someone wants to take advantage of these services, Joanne, what's the best way to contact you guys?
They can look us up on our website, which is homerehabexpress.com. They can ask their doctor to refer them to home care at homerehabexpress.com or call our office, 541-5354.
And then, as always, great to see you, ladies, and we look forward to having you back.
Thank you.
And then if you'd like more information on Home Rehab Express or what they're doing with the Foot and Ankle Group, you can go to our website, and that's at fox4morningblend.com.
Up next, a travel expert will join us to explain why now is the time to start planning and actually booking your vacations for the year.